我爱中医。
我愛中醫。
J'aime la médecine traditionnelle chinoise.
Ich liebe TCM.
Szeretem a hagyományos kínai orvoslást.
من علاقه زیادی به طب سنتی چینی و طب سوزنی دارم.
பாரம்பரிய சைனா வைத்திய முறைகளை மிகவும் விரும்புகின்றேன்.
I love Chinese medicine.
Hello, Professor Wu. I heard that Chinese medicine has a blood therapy. It sounds scary, but it works very well. Can you tell us about it? Bloodletting therapy, often referred to as sishui in Chinese, is a treatment method that involves the specific puncturing of blood vessels in particular locations under the guidance of basic traditional Chinese medicine theory. This technique allows for the controlled release of a small amount of blood from the body. Bloodletting is an effective therapeutic method used to remove pathogenic factors, harmonize the qi in blood, balance yin and yang, and restore the body's righteous qi. In clinical practice, it is mainly performed by using three-edged needles, thick filiform needles to puncture acupoints or superficial blood vessels, and plum blossom needles to tap the skin surface, leading to a limited blood release. It is also known as bleeding therapy. The term bloodletting is derived from the need to puncture blood at locations where superficial blood vessels are available just beneath the skin surface. These blood vessels typically appear as fine, purplish-blue capillaries. Puncturing these vessels is believed to yield better therapeutic results. Bloodletting therapy in traditional Chinese medicine primarily addresses the following conditions. Blood heat syndrome. Bloodletting helps remove excess heat pathogens from the bloodstream, contributing to the cooling and purifying of the blood. Blood stasis syndrome. By releasing stagnant blood, bloodletting promotes the removal of stasis and encourages the generation of fresh, healthy blood. This can treat a variety of issues associated with blood stasis, including pain and swelling. This therapy is particularly suitable for conditions where the underlying problem is related to the blood. It is especially effective in treating pain-related conditions. Clinical applications include headaches, styes, red eye disease, cervical spondylosis, frozen shoulder, stroke-induced hemiplegia, rheumatoid arthritis, heart disease, hypertension, hepatitis, cirrhosis, tonsillitis, appendicitis, and more. In cases where long-standing or hard-to-treat diseases do not respond to other methods, bloodletting therapy on blood vessels near the ankle, elbow, wrist, or knee can lead to unexpectedly positive results. Bloodletting therapy doesn't strictly require specific acupuncture points as the focus is on the general location. The key to achieving therapeutic effects is the volume of blood released. After bloodletting, cupping is often performed. When dealing with engorged blood vessels, the blood is allowed to flow until it naturally stops, and the cups are then applied. Bloodletting procedure. After identifying the area, puncture the blood vessels rapidly using wrist force. When dealing with engorged vessels, the requirement is to achieve a quick flow of blood, and one should be prepared for this. Reactions after bloodletting. Around 80% of patients typically feel immediate relief and comfort after bloodletting, while about 20% might experience an initial increase in pain. Interestingly, those who experience increased pain tend to recover more quickly than those who feel relief immediately. Patients who do not feel any sensation after 5 to 7 bloodletting sessions are not suitable for further treatments. Frequency of bloodletting. For patients with inflammation or acute pain, bloodletting can be performed every 3 to 5 days. For general patients, the recommended interval is every 10 to 15 days. Contraindications for bloodletting. Patients with severe hemorrhage tendencies or those who bleed profusely. Individuals with severe heart disease. Patients with sexually transmitted diseases, skin diseases, or open sores on the skin. Pregnant women or individuals during their menstrual period. Leukemia patients should also avoid bloodletting. Bloodletting should not be performed on patients who are excessively hungry, overly full, or have been subjected to shock, or are experiencing extreme psychological stress. Thank you, Professor Wu, and looking forward the next sharing topic.